So thank you so much for taking the time to be part of this webinar today. My name is Robin Cox, and I am an instructor at OHSU School of Dentistry in the Department of Periodontology, and I course direct periodontal instrumentation as well. Also, I own and manage the Dental Hygiene CE Institute to provide CE courses for local dental professionals, and I'm excited to be doing this today. Today we are going to talk about Glycine subgingival air polishing and the power behind the powder. This is a treatment which I use and have had used on me, and also I train other clinicians to use it properly. So it's pretty exciting for me. So I'm sure that you might have some questions, so I'll take some time in the middle and at the end of the presentation to try and get to some of these questions. So go ahead and send them in as you come up with them. So today I plan to meet these course objectives. I want to be able to clarify the origin and the physical properties of glycine powder and the use of glycine powder as a biofilm removal therapy, describe the safety and efficacy and the benefits of the air polishing as a biofilm management, and of course state the evidence-based treatment recommendations for its use, as well as outline recommended techniques for using the subgingival air polishing powder. So this is a pretty basic course. It gives you a good idea of what subgingival polishing is with the glycine powder. The key concept that I'd like for us to take away today is that subgingival air polishing is a safe, effective, viable treatment option for biofilm management in our clinical practice. And research supports this highly effective treatment that reduces clinician time and delivers biofilm removal more safely than traditional treatment methods. And we'll review how that works as we go along. So let's start first by talking about air polishing in general. Air polishing has traditionally been an option to manage stain, and the air polishing system uses a slurry of water and polishing powder pressurized by air to deliver the effective means to remove the stain and biofilm from the enamel portions of the teeth. That's our traditional air polishing. The polishing powders are key to the air polishing effectiveness. They're used as the abrasive to remove the stain and the biofilm, and there are two common types of powders for air polishing, and a quick review of them will kind of give us a little bit of a reference point. So sodium bicarbonate is the most commonly used, and it has a relative particle size of 60 to 85 microns. Sodium bicarbonate is crystalline and angular in shape, and it has apparent jagged edges on it, as you can see in the 500 magnification picture. It does have a salty taste because it contains salt. The crystalline shape shows evidence of the jagged edges that in turn cause the degradation of hard and soft tissues during treatment. And so it's the characteristics of the sodium bicarbonate that make it unsuitable to use on root surfaces and restorative materials and tissue, but it's an extremely effective stain removal and biofilm removal for the coronal surfaces. The calcium carbonate is a polishing powder that was developed to help reduce the structural defects and to be more pleasant for patients. And you can see that in these images, the calcium carbonate is more spherical in shape, more rounded, and it does have an average size still of 60 to 70. It's crystalline, but it has the spherical shape, so it's softer on the edges. It is neutral and pleasant tasting, and it doesn't contain salt, so there's no sodium-free restrictions. And although the calcium carbonate can still exhibit damage to dentin and cementum, it is meant for use of intact enamel only, and it's slightly less abrasive than sodium bicarbonate, but still meant for just the coronal surface. So many advances have been made in air polishing systems since the original ProfiJet or what have you, the big tabletop units. The cumbersome tabletop units have now been replaced with ergonomic, clinician-friendly handpieces that attach directly to the dental unit, which is wonderful. And many clinicians have forgone the use of air polishing strictly because of the setup and the maintenance was so involved with the older tabletop units. And with these new advancements, both to the equipment and to the powders, which we're going to delve right into, air polishing is really making a resurgence into clinical use. So for our discussion of the subgingival air polishing, the powder that we are talking about and that is widely used is glycine. Now, glycine is an amino acid. It's the simplest and smallest of them. It is colorless and sweet tasting. Glycine is a non-essential amino acid, and it is synthesized in our own body and is essential for many of our own body functions. So it's readily absorbed by our body with no negative effects. Glycine is used in many things that we use daily, for example, substitute sweeteners, protein drinks, supplements, and buffering agents in antacids, analgesics, and also in antidepressants. So it's widely found. It's important to clarify, though, that the glycine is not a chemotherapeutic. Glycine is merely a safe means of the physical biofilm removal with the air polishing system. So it doesn't, at this time, there's no known chemotherapy properties to it. Trials for the subgingival use of glycine began in 2003 in Europe, and it's widely used now in Canada and in European countries. And based on clinical trials and safety analysis for the use in Europe, it has no limitation to the depth of pockets in which it can be used. And Canada's FDA equivalent has cleared it for the use in pocket depths up to 10 millimeters deep. And in the United States, it is cleared to be used in pockets up to 5 millimeters deep. So it's pretty significant. So the size of the powder particulate for glycine is 25 microns, which is significantly less than those of any of the other air polishers. You could compare it to the size of like baby powder particles, which range from 10 to 40 microns, and it's very fine. It has a similar feeling to baby powder as well. It has very little grit feeling, and the particles are softer on the edges, not quite so jagged and pointed, and it's not crystalline either. The size and the structure is what makes it safe for the tooth surface, the oral tissue, and the dental materials, and that makes it safe for subgingival use, and we'll go into that. So, oh, sorry about that. I was clicking on the wrong slide on my other computer. So there are many advantages to the use of subgingival air polishing. Research shows that it serves as a complete biofilm removal on the clinical crown and in shallow pockets, near 100% removal of biofilm. As mentioned in the previous slide, it's safe on tooth structure, including the root surface, and on tissue structure. And it also can remove light to medium stain. Glycine air polishing is indicated for all aspects of periodontal treatment. It's able to remove biofilm in a matter of 5 seconds per site. It's an excellent choice for the use of maintaining healthy mouth or removing biofilm in all areas that are difficult to access, difficult to instrument, and it does not have the negative damaging effects of hand instrumenting. So in the most cherished treatment, though, that we're finding for the glycine air polishing is that of perio maintenance, implant maintenance, and peri-implantitis or implant mucositis treatments. It's safe and effective on the treatment of diseased teeth as well as healthy teeth, and it's widely used as the first step treatment for implantitis and mucositis, and it's shown to be very effective in reversing and halting the disease process of these implant-related diseases. So that's very exciting. But of course, in order to be comfortable implementing this kind of treatment, we need to know that it's safe and effective based on evidence. And I could spend a long time going over all the research that supports its use, but I will limit it to a few studies that demonstrate the safety and the benefits of the subgingival air polishing. So these studies that I'm going to review are very, very condensed, and there's a great bibliography, though, if you wanted to look up these studies and read them on your own. They're really good. So these first two studies highlight the efficacy of the biofilm removal on root surfaces. In the first set of pictures, Fleming noted that complete biofilm removal was achieved in all areas up to 2 millimeters apical to the gingival margin, and an average of 50% removal of the biofilm in pockets up to 6 millimeters deep. And this is significant because it's the same findings for biofilm reduction and removal when compared to hand scaling and ultrasonic. So it's achieving minimally the same in those pockets that are up to 6 millimeters deep. They also found that the calculus present on the root surface didn't affect the level of biofilm removal. So the air pressure is going to clean the biofilm around the calculus and irregularities of the tooth structure or anything that's present on the tooth, which is different than ultrasonic or hand scaling. In the second set, in the second group of pictures and study over here, Peter Silka measured colony forming units compared to hand scaling, and what he found was that the glycine air polishing group showed significantly less colony forming units from 3 to 5 millimeters consistently, and compared to the Curat group. And the interesting thing is that in each of these, all the glycine air polishing treatment was performed in only 5 seconds per site. So while the control groups were scaled until no visible plaque was left on the instrument, and they had no time limit, the time limit was 5 seconds per site with the glycine air polishing. So in both of these studies also, the patients preferred the glycine air polishing over the mechanical debridement and did not find it uncomfortable or unpleasant at all. So Peter Silka further wanted to evaluate other aspects of the glycine air polishing, and he wanted to look at the the aspects in a periodontal infection or in a periodontal pocket, so an active periodontal disease. So the current literature clearly supports that sodium bicarbonate is unsafe to be used on the root surfaces. So they wanted to look at glycine powder and see how it evaluated on root surfaces. And what they found was that the substance loss was 80% less with the glycine groups compared to the sodium bicarbonate groups. Even when the distance was only 2 millimeters away from the tooth and on high pressure, the glycine group showed minimal substance loss. The glycine showed minor abrasions of the dentin with only 2 microns in depth, while the sodium bicarbonate showed deep wedge-shaped gouges in excess of 50 microns. So it was safe on the root surface. And then most importantly, if you're going to use something subgingival, we want to know how that is affecting the tissue or inside the pocket wall. And again, this research was done on biofilm infections, so periodontal pockets. And the safety needed to be evaluated. So he used, during the histological study, he evaluated and he found that the glycine air polishing treated pockets showed no visible signs of epithelial damage. And you can see in the picture over here, this was the control group that wasn't treated. This was the glycine group. And then this is the group that sodium bicarbonate was used, and this is the group that was hand scaled. And the histological slides showed that the hand scaled sites and the sodium bicarbonate sites showed significant damage, while the glycine showed little to none. All right. So the study confirmed that the glycine, these studies confirmed that the glycine air polishing was safe and effective to use for the periodontal patient, and that it may be a better option for treatment in the periodontal, and implant treatment because of the preservation of the the tissue around and in the periodontal pocket. It should be noted, though, that glycine air polishing is not effective in removing calculus, so mechanical scaling is still needed to remove any calculus that remains in the pocket. It is a time-saving treatment because for the full mouth, it takes approximately 10 minutes to treat the whole mouth for biofilm removal, and that's a benefit to both the clinician and the patient. So as glycine air polishing becomes more popular and more studies are being completed, it was like the next logical step was, well, how does it compare to ultrasonic scaling? So especially in perio maintenance and scaling and root planing procedures. So the study by Simon compared ultrasonic scalers, sodium bicarbonate use, and in periodontal maintenance patients, and they focused on the histological changes as well. So overall, the glycine group reduced the biofilm significantly more than the sodium bicarbonate group, and it was compared as equal to the ultrasonic group. And then when they looked at the histological slides, they also saw that the glycine produced the least epithelial damage, and it appeared to be virtually the same as a non-treated site on the inside of a pocket wall. So again, supporting the safety of using it in a pocket and on tissue. So in this study, Bosbe, don't know if I'm pronouncing it right, wanted to evaluate 4 different treatment modalities and their effects on the cementum of periodontally diseased teeth. As we know, during periodontal therapy, cementum is necessary for new attachment and plays a key role in periodontal regeneration. So the ideal therapy includes thorough removal of biofilm, calculus, and endotoxins while preserving the cementum. So hand scaling during the SRP is less favorable to achieve the treatment goals of, as you can see in picture B, pretty much all the cementum is removed. In other studies, it shows that near complete removal of cementum with hand scaling can occur with as few as 20 strokes of a hand scaler. Ultrasonic scaling, with or without combining it with the subgingival air polishing, resulted in only minor irregularities on the surface changes of the cementum, so it left sufficient levels of cementum present. And then the air polishing alone, subgingival air polishing alone, preserved the most cementum with no damage in the structure of the cementum, but it was inefficient in removing calculus. So while the combination of the ultrasonic and the subgingival air polishing was the most time-consuming, it was the most efficient means in removing hard and soft deposits while preserving the cementum, thus meeting the goals of the periodontal therapy. Then, of course, you know, we always want to know more stuff. Every time we do one study, we have more questions. So then we wanted to know, well, is the glycine safe on other kinds of structures? So, and restorative materials. So the Barnes study evaluated surface changes of 3 different structures using 6 different air polishing powders. Each powder was focused on the structure for 5 seconds at equal distance away from the structure and kept in a constant circular motion. And as you can see from this photo, the glycine produced the least amount of damage in the human enamel and was considered to be safe to use on the tooth structure. And then the next items that they compared were composites and glass ionomers. And again, with the same 5 seconds and same distance apart. And the glycine powder produced, again, the least amount of surface change during the study for both the composite and the glass ionomer, making it a safe choice for removing biofilm on restored teeth. And we have a lot of people with a lot of restorations, and to be able to safely polish and remove biofilm is definitely a benefit to our patients and to our clinicians as well. So after reviewing those previous slides and previous research, it's clear to me that glycine air polishing is safe and effective to use on root surfaces, in periodontal pockets, and on gingival surfaces. And as you can see in these before and after pictures over here, that the glycine air polishing left little or no damage after treatment. It's even compared to the curette group, which is still very little damage, but you can see a little bit of inflammation with a little extra bleeding. One of the main outcomes, though, of all of these studies and a lot of other studies that we haven't mentioned is the efficiency of the use of glycine air polishing. All of the studies use glycine air polishing for 5 seconds and there's 4 sites per tooth. So when you extrapolate that, the time to complete a full mouth of 28 teeth is around 10 minutes. So, and that's for complete biofilm removal. Compared to mechanical scaling time, which was used in a lot of these studies that were like to 5 minutes per site, so 90 minutes of treatment to get those same results. And even then, the results were more favorable to the biofilm removal from the glycine. So additionally, patients unanimously preferred it to any of the other treatments that they compared it to. So in our patients, we see a lot of patients with implants and restorative things, and some of our implant patients have healthy implants and some have complications with their implants. Trying to find the right way to clean has been a long-term problem, and glycine subgingival air polishing is fast becoming the preferred treatment method for implant cases, whether maintaining health or treating diseased implant areas. So, of course, I can't just say that and let it be known. I have to show you a couple of little studies. So I just want to take a quick look at some of these studies. Again, very condensed, with a quick overview highlighting the safety and the efficiency and efficacy for implant use. In the first column, they evaluated surface changes of colony-forming units on the titanium surfaces treated with glycine and sodium bicarbonate. And they found that there were no surfaces in the glycine group, but that significant increases in roughness was found with the sodium bicarbonate group. Furthermore, the biofilm formation in the glycine group was statistically less than the sodium bicarbonate group. So it's okay on the titanium. In column 2, this study evaluated several clinical markers, and they compared ultrasonic scaling with a piezoelectric unit to the glycine, subgingival glycine air polishing, and they did this on diagnosed mucositis implant patients or implant sites. And the results were that in both groups, they showed significant reduction of all clinical markers and in periodontal pockets that were equal to or greater than 4 millimeters. But there was a significant reduction in disease sites in both groups. So the ultrasonic and the glycine both performed wonderfully. In column 3, and please ignore the extra R in the abbreviation in that column. It was a typo. But column 3 evaluated manual curettes and chlorhexidine irrigation in one group and glycine air polishing in another group for implant maintenance patients that showed either only slight or no signs of inflammation. So they were looking at just maintaining health. And the aim was to see if they could maintain health with glycine air polishing alone. The results showed that the curette group did not show clinical differences in plaque index or pocket depths at 3 or 6 months, while the glycine group did show clinical differences. But at 6 months, both groups showed reduction in bleeding score. So for each of these studies, there were different conclusions that were reached, but each supports the safe and effective use of glycine for both maintaining implant health and for treatment of implantitis or implant disease teeth. And as with the other studies, the treatment in these studies were 5 seconds per site, and the time efficiency in itself combined with the efficacy may make it the preferred choice for implant treatment. So that was my run of study review, and I'm going to just take a quick look at the questions that have come through and see if there are any commonalities that I can get answered. One of the questions was talking about if you can use the glycine on implants, and I could even extrapolate this into natural teeth, was about open flap surgery or closed flap surgery, and the glycine powder can be used in either situation, and I do a little bit address that later as well. Currently, sodium bicarbonate is used to do some biofilm disruption with open flap surgeries on the periodontium, and it's not always the most rewarding outcome. So glycine can be used, yes, on both. Let's see. There's a couple of questions about why in the United States that it's approved or not approved, that it's cleared for pocket depths up to 5 millimeters. And unfortunately, I don't have a really good answer for that because the FDA doesn't explain why it's just this way, but the FDA approved the treatment based on other treatment, and I'm so sorry, I forget the name. They have a special name for it, but it's existing treatment that has been proven to be safe and effective and safe for the patient. And so instead of reapplying to get it approved for deeper pockets, they sort of just used what has already been approved. So that's how that limited it. And then so far the only problem that has arisen from air polishing is a very, very infrequent case of air embolism, which occurs more frequently with just a high-speed handpiece than it has with subgingival air polishing. And the reason that may have happened is because if there's no attachment at all around the tooth and you use the air and the subgingival air polishing, then that could increase the risk of an air embolism. It's, I think, only like 4 reported cases caused from subgingival air polishing. Okay, so I'm going to go on. I like the questions. Unfortunately, I can't get them all. And some of them I might answer as we go along as well. So equipment choices, there were a couple of equipment questions. So now that we know the treatment is safe and effective, we want to know how to get it in our offices. There are many different types of equipment choices for cosmetic polishing, air polishing, but there are not that many choices for subgingival glycine air polishing. So EMS and Action both have units that are specifically designed for subgingival air polishing with the glycine powder. Both of them also have options for supergingival polishing powders as well. And so since these are the only two major subgingival options and manufacturers, I'll compare these two. So the EMS Airflow Handy 3.0 can be used with cosmetic supergingival air polishing, traditional air polishing powders. And I want to show you that I made a mistake right here, and I didn't get it corrected in time to upload it for the webinar. The Airflow 3.0 can only be used for supergingival air polishing with the sodium bicarbonate or calcium carbonate. The Airflow Handy 3.0, this one over here, the premium one, it can be used with the subgingival glycine air polishing powder, and it cannot be used with the sodium bicarbonate or calcium carbonate. So it comes with this one, the Perio Pro, or Premium, excuse me. It comes with two tip options, one tip that looks just like this to be used around the border or the subgingival area, pockets that are 3 to 4 millimeters deep maximum. And it comes with a tip like this for deeper pockets, which I'll talk about in more detail. But if you're interested in using air polishing for cosmetic purposes and you're interested in glycine subgingival air polishing, then you would have to purchase both of these units to achieve both of those things. You can use one or the other, but they can't interchange. Action makes the Air and Go Easy, and it's a lightweight portable unit that can actually work with both glycine polishing powders and traditional polishing powders of sodium bicarbonate and calcium carbonate. The chamber holds 23 grams of powder, so it's enough to complete 1 or 2 treatments. And the decision to use it for cosmetic polishing or marginal biofilm removal or periodontal pocket treatment is simply dependent on the powder that you have in the chamber and the tip that you have on the end of it. So tip selections are all of Action's nozzles under the Air and Go Easy sign are made of a biocompatible steel that are autoclavable, while the EMS and tips for the periodontal pocket, it's a non-sterile plastic snap-on tip. Each tip can only be used a maximum of 20 pockets, and the manufacturer does recommend to check it after each pocket use for bending at the tip. So that could be problematic. EMS also has an additional nozzle attachment for the glycine air polishing along the gingival sulcus as well. So it's this one right here. So those two choices for that tip. So this supergingival nozzle from, and this is the Action tip, is a supergingival nozzle, and it's used with traditional air polishing powders. It has a 120-degree angle for easy adaptation, and it works great for all applications of air polishing, including prepping tooth surfaces and removing moderate to heavy stains. So it's for supergingival use. Air polishing is safe and it's effective, and many studies do confirm that it's more efficient in removing extrinsic stain, it's less clinician fatigue, it's time saving, and compared to polishing paste and cup. And it's also shown to be extremely effective, in fact, the most effective when using sodium bicarbonate in air polishing system to prep teeth prior to sealants. So the Air and Go Easy allows you, or the Air and Go Perio either allows you to use, to choose your treatment and use whatever you want without having to switch any kind of actual equipment. It's just the powder and the tip. So let's look at the Perio tip applications for that Acteon has available. These tips are meant to be used with the glycine powder only. They are meant for subgingival use, for alternative to traditional treatment. They are no-risk treatment. They have better patient tolerance in pockets, less time than traditional methods is required, as we've said over and over, the 5 seconds. And these tips offer exceptional access to different types of periodontal conditions. So the first one is the Perio maintenance nozzle. Now it looks the same as the nozzle that's used for the standard air polishing powder. However, it is for glycine use only and is noted by the laser marking on the back. And so the diameter of the outlet is much smaller than the standard nozzle to reduce the amount of powder flowing through the head. And the nozzle is used on all of the gingival sulcus area where the pocket depths are equal to or less than 4 millimeters deep. So to use for the patient that does have generalized 4 millimeters or less sulcular area, then the technique would be as these pictures show. And it's a great treatment for your typical adult prophy patient, whether there's gingivitis or healthy, and for periodontal maintenance patients with limited pocketing. And so what you do, you start with the recommended nozzle, which would be this one, and the glycine powder, and you hold the instrument about 2 millimeters away from the tooth surface, and you angle it directly into the gum line, which is counterintuitive, but angle it directly into the gum line or into the gingival sulcus at like a 30 or 60 degree angle, not quite 90, because you want to aim it at the root surface and the gingival sulcus at the same time. And then you just trace with the instrument, you trace the tooth kind of in a back and forth motion or a small arc or like a smiley face all along the area. And you remember that it's only 5 seconds per surface is needed. So you want to just, you know, maybe count it out a couple seconds this way, a couple seconds this way, and then move on to the next tooth. When you're working in the papillae, you still want to angle it in that same 30 to 60 degree. You want to angle the tip so that it is aimed between the mesial side of the root or of the tooth surface and the papilla, and then again right here and at 5 seconds. And you can just move it a little bit back and forth, holding it or up and down, and holding it just 2 to 3 millimeters from the tooth. And it's quite simple, and it's very comfortable for the patient. So it takes a little bit of practice, but it's not bad at all. Pretty easy. So then this next nozzle is the Perio Easy nozzle, and it's got a 20 degree angle so that it can adapt well into the periodontal pocket. And it has like a shoehorn shape to allow the clinician to slide the tip into the pocket, and then the spray focuses on the root or the implant. So this wide working in makes complete biofilm removal really effective and easy for the patient and clinician. So it's going to clean not only the root of the tooth, but also around the sulcus. And then the other Perio nozzle, and it's called the Perio Easy nozzle, or I'm sorry, the Perio nozzle. You have the perio maintenance, perio easy, and perio. So this perio nozzle can be used for non-surgical or surgical use, and it is used subgingival. It has guided spray so that when it's activated, it debrides both the pocket wall and the root of the tooth or the implant. And the working in design disperses spray so that it reduces the force enough to protect the tissue of the inside of the pocket wall, but still delivering enough pressure to completely remove the biofilm in the pockets. And the nozzle has depth markings at 3, 6, and 9 millimeters, so the clinician knows where they're at in the pocket, which is very helpful. So the periodontal pockets, the technique for cleaning periodontal pockets in a closed flap or non-surgical manner is you pick the tip that is going to work for your patient. Pockets and access are different, so whichever tip works for your instance. One tends to be better for deeper, narrower pockets, and one tends to be better for a little bit ease of access. But after you've chosen your tip, you simply insert the tip into the depth of the pocket, and this one's a little bit easier to see. Once into the depth of the pocket, activate the nozzle and slowly withdraw from the base of the pocket to the free gingival margin until the entire pocket is covered, and you just repeat this a few times until a total of 5 seconds in that pocket has been reached. And that 5 seconds is really all that you need to get as much biofilm removal as you're going to. The research shows that they've looked at it up to 10 seconds, and it shows no difference between 5 and 10 seconds, which is great. So just for better understanding, here's a radiographic view of what the adapted nozzle would look like. And then you just pull it out of the periodontal pocket towards the free gingival margin. The handpiece is also very ergonomic. It's lightweight, it's balanced, it's easily taken apart for sterilization. There's easy ways to make sure that it stays unplugged and easy ways to unplug it, if that's even a word, unclog it, if that happens. It's quick and easy to connect to your dental unit, so you can move it from unit to unit. And the shank rotates 360 degrees, so you can adapt it pretty much to any area of the mouth. So it's a nice handle. Of course, whenever we talk about new treatment, we always want to, look at some clinical cases. So this clinical case shows what illustrates what can be achieved by using a combination of air polishing techniques with the Air and Go. So sodium bicarbonate was used for the enamel surfaces, and for the root debridement, the Air and Go perio tip with the glycine powder was used, and the hard deposits were used, were removed with the piezo ultrasonic scaler using a right and left perio tip. So these pictures were taken directly before and directly after treatment. And you can see in the after that the gingiva has very little trauma, bleeding, or redness caused from the subgingival glycine polishing, which makes for a lot more comfort for the patient and easy healing. This indicates something I think that we all see. There's no scaling needed with this treatment. A lot of times implants and retainer bars will come in. They don't have a lot of calculus on them, but they're covered in plaque. And so the treatment sequence for this patient would be to use the glycine air polishing with the perio tip to access the pockets around the implant, like in the middle picture. And then follow with the perio maintenance tip to clean the retainer bar and around the gingival margin to get all of that plaque off around in here. And you could use sodium bicarbonate and to clean the retainer bar safely, but it would require changing tips and changing the powder, and I feel like why do that? We can get it clean with the glycine. So no scaling at all needed, and very effective biofilm removal. This patient presents with a maxillary implant retained denture bar that has been taken off. But you can clearly see that there's pus around the implants over here and maybe a little bit over here, but definitely here. And they had generalized inflammation and redness. So the first treatment, first phase of the treatment was with the perio nozzle for initial treatment, and probably the perio maintenance nozzle for just around the implant itself on the supergingival portion of it. And you can see the clear inflammation. This picture shows the bracket before and after, and I know that it's kind of small depending on your screen, but you can see mature, just packed in plaque in these implant areas where the screws are. So it was taken apart and it was cleaned with sodium bicarbonate and then replaced. And 1 month later, the patient was brought back in, and these implants were retreated with the perio implant tip in the pockets. And you can already see that the tissue is already looking better. And then another month after that, at 2 months, you can see that the tissue is resolving quite well. It's not 100% healed, but you can see how the tissue is tightening over here, and the redness is reduced significantly. And again, this whole implant treatment was done without surgery, and it was done without any hand scaling or even ultrasonic scaling. So it's becoming very clearly effective treatment. So almost done to wrap it up. There's a couple of tips for air polishing, whether you're using subgingival or supergingival. Don't forget to have your patient do a pre-procedural rinse with Listerine or chlorhexidine for 30 seconds, and that's going to help reduce aerosols for you and your patient. Always wear safety glasses for you and your patient because of the powder and the aerosols. And for patient comfort, a non-petroleum lip balm is great because the powders tend to stick to the lips and make them really dry, and that helps out a lot. Some clinicians like to have the treatment area isolated, and it works out really great because it does protect the patient a little bit more, as well as gives the clinician a really nice viewing area. And high-speed suction is important in the use of air polishing to reduce aerosols and to contain aerosols. Sometimes it's difficult when you're working alone, but there's ways to still do it. These two pictures kind of show about how the high-speed suction. On this side, we're doing coronal air polishing for stain removal, and you can note how even though this kind of looks funny, but the active instrument is pointed away from the gingival margin, which is important if you're using anything other than the glycine powders, because it will damage the tissue. Definitely. So you want to have the high-speed evacuation in front or opposite of the air polishing instrument. Whereas if you're using glycine, subgingival air polishing, you're just trying to contain the aerosols a little bit, so you can just have the high-speed evacuation somewhere close so that you get some of the aerosols that are coming out of here. But you don't have to worry about the glycine hitting the tissue, as it will not hurt the tissue. And most importantly, when you do decide to purchase your equipment and begin to provide this amazing treatment for your patients, make sure and schedule an appointment for the representative or the clinical trainer to come and show you the proper way to maintain and treat your equipment, because as with any dental equipment, maintenance is key and to the longevity and the quality of treatment. And Action has a great video library on YouTube. They have a YouTube channel that shows you how to clean, maintain, troubleshoot, and also general all-purpose use. So it's a great source. And now I'm going to take a look at some of these other questions as they come rolling in and see what we have. I like this one. Somebody said the benefit of air polishing is fun, and it is fun. I'm trying to be all, you know, academic here, but it's super fun to use, and it's so effective that that even makes it more fun. I'm looking through these. The one thing I didn't talk about was the cost of the units, and I don't know a lot about how much all of the units cost. I'm not a salesperson, so I really don't know. I'm going to say between $1,700 and $2,300. So just contact your local equipment rep and ask them. But I do know that the Action and the EMS units are in the same price range. And the Glycine air polishing powder is available through Action as well, and they actually have a really large selection of the stain removal powders as well that your representative can let you know about. I don't know much about the money stuff. Just reading through these real quick. There is a question about using it for biofilm removal supergingivally before composite restorations are placed. And I don't know if I have read any studies if there's any problems with the glycine and, you know, the composite materials sticking. I know that using sodium bicarbonate on like an occlusal surface is an excellent pre-treatment or pre-preparation for a tooth. But if you're just trying to remove biofilm, I wouldn't see any problem with using the glycine for biofilm around the tooth, especially like a class 5 filling or something like that, because glycine is so small and it's so readily absorbed that even if you used it along the margin of the tooth and the gingiva and then just rinsed it off, it would probably be fine. I don't think that there would be any retention problem. I don't know that for sure, but I don't think it would. And even though the glycine has been, you know, I'm talking subgingival, the glycine can be used on supergingival surfaces. When I use glycine on my patients, my perio maintenance patients and my prophy patients, I start at the gingival margin and in the pockets, and then I go back at the end and I do all the crowns of the teeth. And the patient report is that their teeth feel just slippery clean. And again, the glycine is safe on enamel, dentin, cementum, tissue, and implants. So it's also safe on porcelain, gold, and composites, and other resins. So it's a pretty safe material all in all. It's a real favorite for prosthodontists and cosmetic offices that specialize in cosmetics. I think that I got through most of the questions. There is a question about SRP, and I have like a couple of minutes, so I might address the treatment modification issue, which I left that slide out, but it's a good question. There's a little, you can do the subgingival air polishing either before or after your scaling and root planing, or your your mechanical instrumentation during period maintenance. The idea is that you only use hand instruments or ultrasonics, which would be my personal preference, ultrasonic scalers, after only for the remaining calculus. So if you go in first with your air polisher and you biofilm debride the entire mouth, including periodontal pockets, then you can go back in and assess the areas that still have remaining calculus, and then just hit those areas with your ultrasonic. Thus, it's not only going to take 10 minutes to clean the mouth, but it's still going to reduce the overall time that you use, because you're not using your mechanical debridement techniques on every single surface of every tooth, because it's not really needed, especially with a lot of perio maintenance patients. They come in very frequently. Our main goal and objective is to remove the biofilm that's in the pockets to keep those colonies from forming and causing more destruction. So I might not be getting buildup in those pockets every 3 months, or maybe just a little fleck here and there. Of course, you always have the lower anteriors that you have to scale, maybe the second molars on the maxillary, but you can get that with the ultrasonic, and then just focus calculus removal where there is actually calculus present. And otherwise, biofilm disruption is very much in support of periodontal therapy and periodontal maintenance. But it doesn't matter whether you do it before or after your actual scaling. I prefer to do it before, because then my exploring is it's more honed. I'm not running into chunks of plaque when I'm trying to assess the root surfaces or where things are left. Well, I hope that answers some of the questions that you may have been having over the time. And I, again, appreciate very much everybody checking in and taking time out of your life to listen to me share my excitement about subgingival air polishing. And I hope that you get an opportunity sometime soon to experience it with a patient yourself. Really great questions today, too. Thank you very much.